Right, so now we are on session 10. If you look at your study guide, you realize that you need to read some of the things on your own, because I've told you from the beginning that this is a course that is really loaded, okay? So things to do with the mouth and the throat, for example, cleft palate, cleft lip, esophageal atresia, and those things. I gave it to you as reading assignments on your study guide. So please remember to read them in addition to what we have been discussing. So session 10 looks at liver cancer and cholelithiasis. And in I think session 4 or so, we discussed cancers. A cancer is a cancer. So liver cancer is a cancer that affects the liver. And of course, the characteristics of cancer that we discussed in session 4 applies, where the cells are growing out of control and is affecting the functions of the liver. Remember that anytime we mention cancer cells, these cells cannot perform the specialized functions. So deamination, formation of the bilirubin and all those things, the liver cannot do it. So when you have liver cancer, it means that all these primary functions of the liver are affected. So the etiological factors include infections. Remember we said bacteria, so viruses, so hepatitis B virus, cirrhosis of the liver, chronic liver disease, smoking, and any other thing you can think of, you predispose you to liver cancer. Let me say here that the known cause, this is the cause of cancer, is unknown, is idiopathic. You can't really say that this is the cause of cancer, no. But we have predisposing factors, things that can put you at risk. So that is what we are talking about. So when you have the cancer, like we said, the cells is initiated, we can promote it, progress, and it can move to the other parts of the body. It's the same for all cancers. Now, apart from the hematologic cancers, of course, the clinical manifestations for every cancer patient: you lose weight, you can't eat, you may have fever because there is infection, because the liver is affected, liver to do with jaundice issues, abdominal distension, ascites, and all that. Then we would have to do your physical examination, we'll do a scan, x-rays, take sample of blood to the lab, and then remember we mentioned the chemotherapy. So we give you these chemotherapy drugs, 5-FU, adriamycin, etc. And then we can do radiation therapy for you, gene therapy if necessary. And surgically, we can remove a lobe of the liver if it's detected early. I'm sad to note that most of the cases of liver cancer come late or are diagnosed late. By the time they realize it's a tumor or it's a liver cancer, it's really late. And we can do liver transplant for you. And because the liver is in the abdomen and is an abdominal surgery, all that we have discussed in the previous session still holds, you know, teaching the person coughing exercise, because the person cannot digest fats. You have to omit fats in the person's food. Deep breathing exercises, input and output, and making sure that the patient eats when the tubes, the NG tube is removed, when the bowel sounds are working. It's all here important. So we talk about cholelithiasis. Cholelithiasis has to do with stone in the gallbladder, and the gallbladder is also in the abdomen, and it's close to the liver. So when you have liver stones, we can take you to the theater and also take the stones off. So when you are aging, you are predisposed to have more stones. You are obese, family history, pregnancy, etc. Now, the stones, it can be different types depending on what they see. So if you have the stones removed, whether it is type A or type B, the important thing is that you must tell the patient that if you don't take the stone out, it can block the ducts in the gallbladder and your bile cannot flow, and it can go back into the blood and you become jaundice, and it can affect other parts of their body. So that is an important thing to tell the patient. And once it's an abdominal issue, the various tests that we have talked about is also repeated here. Now, you can have a stone and there's no problem if it's not big enough and the flow of the bile is okay, because it's not a primary disease, okay? And when it becomes big and obstructs the flow, that is where you have problems with the with pain and other things, the jaundice and all that. So please note that cholelithiasis, small stones, can be asymptomatic. So when you have the gallstones, the patient can have a procedure where shock waves are used to kind of break the stone down into smaller pieces for it to come out of their body or flow out of their body. Or you do an endoscopic surgery where you use the instrument to remove the small stones, or you open surgery and you take the stones out. And once again, because it's an abdominal surgery, we have talked about so many things about abdominal surgery today, and I just encourage you to read all the slides that I have on the Sakai platform so that you can benefit from this more.